Today, I'm with Stacey Pidgeon. Now, Stacey is the National Manager of Research and Policy with Royal Life Saving Society of Australia. Stacey has a background in health promotion and injury prevention, having done her undergraduate degree in health promotion and psychology and postgraduate studies in public health. Stacey is currently undertaking a PhD at James Cook University, focusing on drowning prevention among high-risk populations in Australia. Now, Stacey has conducted a range of water safety and drowning-related research and programme evaluation in both Australia and New Zealand. Her areas of interest include diverse populations, youth, and the impact of social determinants on injury and health promotion outcomes. Before moving to Australia from New Zealand, she's a Kiwi. Stacey's previously held roles with Drowning Prevention Auckland and Auckland Regional Public Health Service, working with migrant and refugee communities to develop and implement health promotion programs, including drowning and water safety programs, of which many programs are still in place today, which is awesome. So I'm really pleased to welcome Stacey. How are you going, Stacey?
Good, thank you. Thank you so much for having me today.
Oh, you're very welcome, and I'm really looking forward to this. So we'll get straight into it. What does wellbeing mean to you, Stacey?
For me, well-being is about being healthy and happy, having balance, connecting with family and friends, getting outside, getting physical activity, but also making sure that you've got that balance. The physical and the mental health and well-being is really important.
Yeah, and you're saying get outside. Where are you coming from today?
So I'm in DY on the northern beaches of Sydney. I try and go out for a walk most mornings, and I do enjoy my running as well. That's certainly picked up over the last 18 months with COVID and being at home. It's easy, pop on a pair of shoes and head out the door. And when sort of we're not in lockdown, we do try and get out to explore some of the national parks and bushwalking and camping as well. So I think getting out into nature is really important. Connecting with that, whether it be sort of in the bush or in the water, I think that's really, really important. It's nice to switch off. We're so connected to technology and screens and things like that. So it is nice just to be able to get out and switch off every now and then.
Yeah, I mean, living on the northern beaches, it's on your doorstep, isn't it, in terms of all the, great environment that you've got around there. But absolutely so important to get outside and keep your well-being in check. So are there any other things that you do to look after your well-being? You've obviously got your walking and your running that you love.
Yeah, I actually don't mind a little bit of cooking when I have the time. I'm certainly no master chef, that's for sure, but I do enjoy it. It's just another way to switch off, I think. Enjoying, I guess, cooking and being able to throw some ingredients together. My preference is cooking, not baking. I've made far too many mistakes with baking, and I don't really like sticking to a recipe. So. But also as well, catching up with family and friends. A lot of my family is in New Zealand, so being able to catch up with them over the phone or FaceTime is really important to me as well. And checking in with friends who live around here, but also in other areas as well.
Yeah, that connection bit's really important. I actually baked my first cake last week for my fiance's birthday, and it didn't turn out too well.
Oh, no.
So it's a work in progress with my baking skills. But yeah, that incidental exercise you talk about with cooking, I think we've kind of manufactured a lot of that out of our lives these days, with Uber Eats and things like that. So it's a good way to exercise and do a bit of movement as well, isn't it? So.
Yeah, and it's getting the brain working in a different way as well, I think.
Yeah, absolutely. So tell us about your role as the National Manager of Research and Policy at Royal Life, and really interested to unpack the PhD that you're doing at the moment. Sounds super interesting.
Thanks, David. So at Royal Life Saving Australia in the National Office, we do have a research team, and our research does inform all our campaigns, programs, and practice. So we do have a large research program that we've been known for a very long time. Every year we do produce the National Drowning Report, which we'll talk about soon.
Yeah.
But we do have a program of research work that is all connected to the Australian Water Safety Strategy. And so all of the priority areas in the strategy, and we have recently, the Australian Water Safety Council has recently released the most recent one for 2030. So this one's a 10-year strategy, and all of our work does underpin those key areas. So whether or not that be drowning in children, drowning doing different activities, so swimming or boating, and priority populations, so Aboriginal and Torres Strait Islander people and multicultural communities, and also males is a big one for drowning and drowning prevention as well. So my research entails looking predominantly at multicultural communities here in Australia, but I have done a lot of research around the swimming and water safety skills of children in Australia as well, which has helped to underpin the National Swimming and Water Safety Framework revision that's been recently released as well. But we do a lot of different research, and more than happy to share that. We've got a whole bunch of reports on our website as well, and we're always looking at ways to partner and how we can provide research to inform programs and policy and things like that. So in terms of my PhD, it's very much linked to that priority area of the water safety strategy of reducing drowning among multicultural communities here in Australia. And I guess for me, that's something that I'm really passionate about. It started off with my work back in New Zealand, working that you mentioned earlier, working really closely with migrant and refugee communities and youth. And we use water safety, I guess, as a tool for development, youth development, leadership development, as well as obviously increasing those vital swimming and water safety skills, but also looking at other outcomes such as, empowering people, that self-confidence, helping people build up the skills and knowledge for, careers or things like that. We had a lot of the youth I worked for, when we asked them what they wanted to get out of the program. For some of them, it was about being able to pass a swimming test to get into the police, or, to get into the Defence Force and things like that. So for some people, swimming actually is a barrier for career and for jobs and things like that. And for others, it was about learning, to be safe when they were out with their family and friends. So everyone is learning and for different reasons. And there's also as well a lot of adults who don't get the opportunity to learn these vital swimming and water safety skills when they've been in their own countries growing up, for a multitude of reasons as well. So it is an area I'm very passionate about, and trying to, I guess, not only the long-term outcome obviously is to reduce drowning, but provide some of those other outcomes as well, and also introduce people to, all the wonderful opportunities that learning to swim and learning water safety skills can provide. So again, whether or not it's a career or just simply participating with family and friends, or doing some of these other activities, I think watching the Olympics, it's a very good, I guess, reminder of all the different sport and recreation activities that do involve the water. So whether or not that be water polo or surfing or windsurfing, kayaking, canoeing, all those types of things that people do in their leisure time and for fun. So there are lots of different reasons for people wanting to learn swimming and water safety skills. And also for some people, it's just about, an achievement, a personal achievement for them. Some of the adults that I've been speaking to recently as part of my research, they've used the term, it's my Everest. So their Everest was learning to swim and being able to swim that first lap of the swimming pool without stopping, which is really inspiring and motivating as well, and also reminds people that you can learn to swim at any age. It's something that's not restricted by age, so it is really exciting.
And where's this passion for water safety come from? So it's really evident. Obviously, you've spent your career looking at this stuff and supporting communities. So yeah, where's that come from?
A few different things. So back in Auckland, I was very heavily involved in surf lifesaving on the beach, on the west coast at a beach called Piha, which is known to be quite rough, big waves, big surf, all that sort of thing. And we did get a lot of people come out to the beach who got caught in rips and currents and got into trouble. And it was simply, I guess, not knowing, I think, for them. And I guess I kind of saw an opportunity of people who genuinely wanted to go, and participate and get into the water and things like that. And there are actually a lot of people that go fishing, whether that be rock fishing or net fishing or go out in a boat, but simply didn't have the skills and hadn't been given the opportunity to learn those skills. And it's very much the same here in Australia. There's lots of people who I think are very attracted to the water, and we know that, for example, international students, one of the key reasons they come to Australia is for that coastal and that water environment. And so for me, seeing it firsthand that people getting into trouble when they didn't intend to be, no one intends to get into trouble. They just don't know why. The red and yellow flags are there, but some people don't really know what they're there for. And it's not them being ignorant by any means whatsoever. It's just simply they haven't been told or don't know. And so also what we're seeing again here in Australia is there's a lot of people who go to rescue others. So children, for example, so parents going in to rescue their children that they might see in difficulty. And unfortunately, the parent or the rescuer is actually the one who drowns, not the person who was initially in trouble. So I think I've seen it firsthand, but I guess from a life-saving point of view, but also as I've sort of gone on and working with people, and I do say working with because a lot of the communities who I did programs with back in Auckland, we designed the programs together. So I think that's really important, is actually sitting down with the communities that you're looking to work with or wanting to work with and talking it through. Because I also think the other thing I realized is some of these communities don't see themselves as being at risk or a high risk group for drowning. Drowning isn't, they don't really think about drowning in the way we do it. They don't see themselves as being a high risk community. So it's also making them aware, that water safety is really important, but sometimes it's about focusing on the positive. So the positive benefits of swimming and water safety, not focusing on the negatives, which obviously is drowning. So I do think we need to look at it that way sometimes as well. It's really about the positive benefits of families being in the water together, learning together, and being able to participate rather than focusing on, what can happen, which can be drowning, unfortunately. But on the flip side, that also does, I guess, get some communities into action as well. Something's happened in their community. Unfortunately, someone has passed away, and they really want to do something about it to stop other people from going through that as well. So there's sort of both ends of the spectrum. But obviously, we don't want anyone to drown, and we want to prevent as many drownings as we can.
Yeah, there's definitely an advocacy piece, isn't there, in terms of education. I was recently doing a workshop in a refugee college, and we did some water safety actually, Stacey, and we put up the flags, and then we got the students to write down what they thought that meant, and some of them thought that was where you couldn't swim in between the flags. So it's interesting. If you don't know, you don't know, do you? So there's definitely education around what those flags mean. It might be for most of us quite evident, but for others from different parts of the world, they don't realize what it actually means. And I've firsthand actually experienced how rough the water is. I'll tell you a little story. First time I ever came to Australia, I went with my family to the beach, and the water was only actually hip high. And they said, yeah, just be careful. And I was like, no, I'll be all right. And I dove in, and yeah, it went up to my hip, and the wave came in, dumped me upside down, and I dislocated my shoulder. So the water can be really rough, can't it? In terms of how powerful it is. People don't realize.
Yeah, that's right. And it's not only just at the beach as well. Rivers are the leading location for drowning across Australia, actually. And I think that's something that not many people realise. But of course, rivers don't have flags or lifeguards to tell us where it's the safe place to swim. And they equally have fast-flowing currents as well.
Yeah.
The water can be cold. We don't know what's underneath it. It can be deep.
Yeah.
And we actually do know a lot of, people do come to Australia that might live in areas in their home country that may have had rivers and creeks and all that type of thing. But again, the water is very different here in Australia as well. So it's not just the beach we have to be aware of, but all these other waterways as well. And rivers are often in sort of isolated and more remote areas as well. So those types of locations can make it harder for emergency services to get to or to raise the alarm. And so that's why it is really important that we are aware of water conditions, not just at the beach, but in these inland river locations as well.
And so is your PhD right across the board, in terms of riverways and waterway, and as well as beaches and swimming pools? I mean, obviously it's got the migrant populations focus, but yeah, tell us a little bit about what are the outcomes that you're looking to get from the PhD?
So I guess, yeah, going back to the PhD, my research is really focusing on drowning among migrants in Australia, but also drowning prevention strategies. And that, you're right, it's across the spectrum. A few years ago, when we started looking at this issue, we realized in the previous strategy that high-risk populations were all lumped together. So migrants, international students, Aboriginal and Torres Strait Islander communities. And we obviously know that all of these communities and all of these groups are very different, and they shouldn't be lumped together. And so we didn't actually know, country of birth of where some of these people were coming from, but also, the backgrounds and how long people had been in Australia and what the risk factors really are. There has been a lot of interest in doing swimming and water safety programs for people from multicultural backgrounds, which is fantastic to see, but we didn't necessarily have the evidence behind saying why and who was drowning, and we just needed to know a little bit more about the evidence behind it. It's still really important, don't get me wrong, but from a research point of view, we do need to have the numbers behind it to provide the support and the justification for why we're focusing on this particular population. And so I guess there's a few different parts to my PhD. One is certainly looking at the numbers, and we did that recently. So I did a study with my supervisors, Dr. Richard Franklin, Dr. Peter Leggett and Dr. Sue Devine from James Cook University. And of course, with Royal Lifesaving, we looked at, I guess, the numbers of migrants in Australia who have drowned. And I guess I use the term migrants as people who have moved to Australia, like you and I, from a different country, and who are now residing in Australia. And so that study didn't include international students, which we know also is a bit of a group of concern. That's actually something I'm looking at the moment. And what we found, I guess, was some differences in terms of how long people had been in the country for. So we certainly saw those new arrivals, so people who've been in the country for less than 5 years, but also people who'd been in the country for a longer term, so 10 years or more. So they were the two biggest groups that we saw in terms of drowning. And also when you broke it down by how long someone had been in Australia for, that also differed of where they drowned and what they were doing. So we're starting to build a bigger picture, or a better picture, I should say, of how we can better tailor drowning prevention programs, and that everyone's different as well. So when we start drilling down to some of these populations, some messages might not resonate with others, and certainly there's an argument in terms of when is the best time to provide drowning prevention and water safety education. Is it when people are newly arrived? You want to capture them, you want to get them before they go and do all these wonderful things in the water, go to the beach, go to the river, go to their local swimming pool. But on the flip side, I think some of my research that I'm doing, the qualitative research I'm doing, is starting to show that when people first arrive, there's lots of priorities. So it's getting an education, getting a job, getting a house, and water safety and drowning is just not top of mind. They don't realize, which is perfectly fine. There's obviously all of these priorities going on, new country, new culture, new language for a lot of people as well. And so we're seeing people, particularly adults, getting more motivated to learn to swim a little bit later on once they've settled into the country. And actually with some of the people who I've spoken to, their kids have been their motivation for learning to swim. So that's been really interesting. People will definitely see the value of swimming and water safety for children. There's no question about that. It's important for their kids to learn to swim, put the kids in swimming lessons, but it's not so important for me. So some of the adults I've been speaking to recently, they've sort of said, oh, I've been in Australia for 10 years or, 12 years or 15 years or whatever it might be, and now is the right time for me. Or I'm sitting there looking at my kids swimming and I'm thinking, oh, I'm missing out. How can I learn to swim as well? So I think there's definitely an argument for both. There's no doubt about that. Great to get people when they first arrive, but we do have to be, I guess, sensitive of how we do that. And then you've also got sort of people who have been here for a little bit longer, more settled, and have maybe the time and the money to do these water-based activities, and we want them to be able to do them safely. So introducing people to swimming and water safety lessons is something that we should be encouraging, but when it's the right time, I think, is a big thing. So that's also part of my research, and some of these findings are really, really interesting. So I'm halfway through in terms of the PhD, I guess about halfway through at the moment, and I'm doing a lot of qualitative interviews and focus groups of people who have moved to Australia, and some of them have learned to swim and some of them haven't learned to swim, and really, I guess, looking into the barriers of why people haven't, and then looking at sort of, I guess, the motivations for those who have got into lessons. So I mentioned some of those before.
Yeah, wow. Well, you've certainly taken on the big topics, aren't you? And I think working and doing a PhD as well, you certainly like a challenge. And I really found that interesting in terms of when you step back and think about migrants coming to a country, what are their priorities? So whether it's education and, they're trying to settle into a place, maybe swimming, like you said, is not high up on the agenda. I wonder if part of that transition pack or whatever they get when they arrive here is, swimming lessons to, and it's part of I suppose, the introduction into the Australian culture, because we are, a nation of water lovers, aren't we? Really, we're on an island, and it's a big part of the Australian life, whether it's with swimming pools or beaches.
That's right, and there are some programs that do focus on new arrivals, and there are some fantastic programs going on. So I think there's certainly room for, programs at all levels. We just need to be, I guess, sensitive of when and where they're being delivered. But yes, there are definitely programs being delivered to new arrivals, which are fantastic, and equally there are programs available for adults who have been here for a little bit longer as well. So I think there's a room for, there is room for prevention strategies at all ends of the spectrum. And how we do that they all need to be tailored to that particular community as well. So I think that's just something to keep in mind, and what I'm finding through the research I'm doing. So I am looking at programs that are catering to new arrivals, and equally programs that are catering to migrant adults who have been here for a little bit longer.
Yeah, and I suppose if we're talking about it from a systems perspective, it's multifaceted, isn't it? It's not just one kind of intervention. There's lots of areas where you're having to come at it from to try and, I suppose, reduce drownings, I suppose, and improve people's swimming.
That's exactly right. Yeah. So I think obviously that is our main outcome, is to reduce drowning, but obviously that's a long-term goal as well. But there are lots of other benefits of swimming and water safety, and we know that the programs do. Some of the research I have done that has been published has looked at the benefits of swimming and water safety programs for migrant adults. So things like the socialization aspect, people going with meeting new friends, going with family, going with friends, meeting new people, getting used to their local environment, going to their local swimming pool for the first time, that sort of thing. The health and wellbeing benefits, of course, mental health and social health, physical health. So definitely there are lots of different benefits to these programs, not just swimming and water safety skills. And it also includes a range of partners, so not just within the aquatic industry as well, which I think is really important, that we do have to be looking outside of the industry and partner with different organizations as well, which is really important. And it means that the participants get more benefits as well.
Yeah, absolutely. And that health and well-being aspect, we'll touch on it in a little while, but there's not any activity that I feel better than when I've done it than swimming. I think, it just makes you feel so good after you've been in the water. But it's really topical that we're speaking to you today, because obviously it was, I think it was last Sunday, was the inaugural World Drowning Day, and an historic day, Stacey, which I'm sure you're well aware of. But from the United Nations resolution on global drowning prevention, which was adopted in 2021, April, I think, and the stats that I was looking at, around 236,000 people's lives are lost to drowning globally, and with 90% of those from low and middle class kind of income countries. And there's hundreds of families, unfortunately, that mourn loved ones each year in Australia. So in terms of the day, and what are your thoughts on that? And how was Royal Life involved?
So you're right. The first World Drowning Prevention Day was held on Sunday, the 25th of July. And Royal Lifesaving did a number of things. So we did create resources for the industry to use. We've got a website that was linked to the WHO website as well. And there's been a whole range of different webinars on drowning prevention, both here in Australia and across the globe, actually. I was sitting on one last night and the night before. So there's a lot of I guess, excitement about this as well. And I think what it has done is brought an awareness at a global level. The WHO calls drowning a silent killer, so largely neglected. Most of the burden, as you've said, is in low and middle income countries and young children as well. So there are hundreds and thousands of people that do actually die from drowning across the world. And I guess in Australia we're doing our part. And I'm sure lots of people are, doing their part. Drowning, we hear about in the media, but it does put it in perspective that the numbers are so much larger in low and middle income countries. And it also, I think, raises awareness that the context is different in those countries as well. So it's about daily living, water transport, people collecting water around the home or doing daily chores. And that's unfortunately when people do drown, as I said, a large number are children. Whereas here in Australia and other high income countries, drowning is largely recreational and when we're doing leisure activities. And so there is quite a big difference there in terms of the type of drowning and the context of drowning. So I think what World Drowning Prevention Day has done is really brought awareness around the globe of drowning. And also an opportunity to work across sectors. So like we were talking about before, lots of people think about swimming in a sport and recreational context, but there's lots of links to child and maternal health. When you first have, I guess, with babies, learning how to bath babies and supervision around the home of our Keep Watch program does actually touch on this. So keeping watch of children around the home, whether that be baths or buckets or pet bowls and on the farm, things like that, but also disaster resilience and flood mitigation. We've seen flooding here in Australia. There's been flooding across Europe and in parts of Asia. So I think those types of things we need to think about as well. And unfortunately, every year we do actually see people drown due to floods as well. And people might not be aware of that. So I think that's quite important to think about. And also the maritime safety sector here in Australia plays a big role. So maritime safety, wearing life jackets in boats, the blood alcohol testing when you're out on the water, the Bureau of Meteorology as well, so that put out dangerous surf warnings and wind warnings for people who go out on boats. So there's so many different players and so many different organisations and sectors that actually do have a role to play. And I think that's really important to remind people that it's not just about the aquatic sector, which certainly do play an amazing role, but it's much broader than that as well. And I also think as well, here in Australia, we've put more emphasis on non-fatal drowning over the last few years as well. So yes, we know drowning can be fatal, but equally as important is our non-fatal drowning as well. So where people do survive a drowning episode, but they may survive either with no complications or long-term injuries, or those who have long-term implications and injuries and things like that. So I think it's really important to remind people about those things, and also that drowning can happen anywhere at any time when we're least expecting it. So I think with World Drowning Prevention Day, it's all of those things that we do need to be aware of. And it was also about calling to action what people are going to do. So it's not just high level at the highest level, whereas governments, obviously the UN resolution had governments sign up to that and supported that, including Australia, but it filters right down to the individual level as well. What can we do to prevent drowning at an individual level? And it's easier than what you might think. So, again, supervising kids around water when they have bath time. It could be, telling kids about rules around water, making sure they don't go around the water, without an adult, making sure, everyone puts on a life jacket when they go into the boat, all those types of things. So it's not, I guess, just at a high level. We can all take action.
I think that silent killer that you talked about is interesting, and it's everybody's responsibility, I suppose.
Yeah, that's a great way of putting it.
Water safety, and the way you were describing it is there's so many different parts and sectors to kind of supporting this common goal, isn't it, in terms of trying to reduce drownings and the awareness of it. So I think the World Drowning Day is one good part of it, and in terms of that advocacy piece. So and how's that linked to the National Drowning Report then? That was I think, was it commissioned last year? And how's that? How are we going with that report?
So every year Royal Lifesaving produces a national drowning report, and we're in the throes of putting together the next one, which will be released in September.
Is it a big piece of work?
It's a big piece of work every year, and we've got a fantastic team who do that, and we do collaborate with our partners at Surf Lifesaving Australia as well. And we're very lucky that we do base our data from the National Coronial Unit in Melbourne as well, who are always a fantastic support. But in terms of the National Drowning Report, last year what we did see was drowning deaths continue to decrease, which was, very pleasing to see. There are certainly a few, I guess, areas with COVID that we have seen a few trends, but it's still a little bit too soon to tell. So it'll be interesting to see what the data shows in this year's report. Again, males, 80% of drowning deaths, and last year we saw the largest age group were people aged between 25 and 34 years. Pleasingly, we did see a 50% decrease among young children under the age of 5, and rivers again were the leading location of drowning, followed by oceans and harbours. So,
and why, Stacey, do you think 80% is male?
That's a really good question, and it's one that we continue to, I guess, investigate and look at. Over the years, I guess we've seen things like with our studies and our research, males tend to overestimate their ability around water and sometimes underestimate the risk of drowning or the dangers, I suppose, in those sorts of areas. And I guess one thing we are starting to look at is exposure. We do know that, men, both males and females, go to waterways, go to the beach, yet we're seeing more males drown, even though both males and females are participating around these areas. And some research that I was fortunate enough to be part of with Dr. Stacey Pidgeon, who did her PhD on river drowning. We breathalyzed people around rivers a few years ago as part of her PhD, and her research showed that we did actually have an equal amount of men and women at the rivers that we went to. And actually, in some cases, we did find that females sometimes had a higher alcohol reading than what men did. So
sorry. You were just going along the river randomly testing people's alcohol limits, and they were quite open to you doing that with them.
Well, that was a very interesting research project, and I give full credit to Amy, because this was all part of her PhD, and it was very, very interesting. And I think it was part of her research to both survey and breathalyze people in summer along rivers in New South Wales and Queensland. And we had sort of a little bit of media around it and things like that. So it was quite interesting. People really wanted to see how much they would blow in the breathalyzer, but we had to say, well, no, you're going to do a survey first. We want you to do the survey first, then you can do the breathalyzing. So that was really interesting, actually. And yeah, most people were more than happy to do that. I think from memory, there might have been one or two that didn't want to, but I think because we were doing it for research purposes, there was nothing sort of attached to it. We weren't collecting personal details or anything like that. It gave us a really interesting, I think, insight, but also the data around that. I guess we know that alcohol does play a part in drowning deaths, and particularly around rivers. So to actually get, I guess, an actual reading of what people are doing around rivers was really, really interesting. And so I think with males and females, as I said before, we had equal amount of males and females at the river and drinking as well, but obviously more males are drowning. And so we don't know it for sure, but whether or not females are more risk averse, choose not to go swimming, particularly if they have had a few drinks and things like that. I think the really important thing is that we know that people are, we're not telling people not to have a good time, not to have a drink or two with your picnic or things like that, but it's actually about saying think twice before you go in the river or before you go in the water, because we know that alcohol does impair judgment and coordination, balance, all of those things. And what our data is showing us, that those people who drown with alcohol in their system, they're not just having one or two drinks, they're having a lot to drink and then getting into trouble in the water. So certainly we want people to have a good time and enjoy themselves, but maybe save the drinks for at home, and that type of thing, because it does increase the risk. There's no doubt about that.
No, for sure it does. And you mentioned there COVID. Do what's your thoughts on learn to swim and the impact that's going to have potentially on drownings with a lot. I mean, we're in New South Wales at the moment. There's another lockdown for another 4 weeks. So yeah, what's your position on that?
It is interesting. Last year we did a little bit of research with swim schools and things like that to see sort of what the impact was on swim schools, and we certainly saw around a quarter of all children weren't returning to lessons.
Wow.
However, at the beginning of the year, we certainly saw increased enrollments again. And so I think it depends on every state and territory. Obviously, every state and territory have had different experiences with COVID and with lockdowns and things like that. But certainly children are missing out on swimming and water safety skills, and that's something we're really concerned about, and something that we're looking at the moment. It also means that there's more children around, so more children at home, not in school. It has just been the school holidays as well, so kids out and about near the water, which, as we've talked about before, has some amazing benefits, but it also means that potentially that's putting them more at risk of drowning, in some of these near some of the beaches or rivers or creeks or even dams that they might not have access to otherwise because they're at school. So, and also we might be seeing more drowning during winter as well, with people being at home. And then I guess over the summer as well, the temperatures were really high. There was, less restrictions, and so more people potentially going to isolated areas that weren't patrolled, to stay away from the crowds and the people. But again, that brings some risk to it as well. On the flip side, I guess there's also the opportunity to increase knowledge and awareness. So there are tons of resources, both Royal Lifesaving, Surf Lifesaving, a whole bunch of different organisations that have swimming and water safety resources, and I guess resources that can be very engaging for kids as well. So whether or not they're videos, I know Lifesaving Victoria has been doing a lot with virtual reality as well. So I think it also gives an opportunity to increase that knowledge and awareness as well, that maybe sometimes again is forgotten because people are concentrating on skills, but knowledge and awareness is just as important as well. So I would encourage, I guess, parents or people who are watching to actually maybe think about the knowledge and awareness and look at some of these resources in preparation for, again, going to swimming lessons, or as we head into, I know it's winter at the moment, but I'm sure summer will be upon us very soon. So getting to those areas again, and just reminding parents about the rules around water, but also, things we talked about, river safety, that's very different from beach safety, and things like that. So, but yes, I think COVID will have a bit of an impact, and I guess there has been from colleagues in the maritime safety sector, we've seen boat registrations and people buying boats and kayaks and stand-up paddleboards and things like that, which is again good for people getting out on the water, but it means that we might be seeing people who are maybe less experienced on the water as well. So I think there's obviously the benefits, but there's also the risks, and we need to make sure that people do have that knowledge and awareness if they are going out on the water and buying these boats and kayaks and stand-up paddleboards, and making sure people have got life jackets and all that type of thing.
Yeah, I really liked what you said there, particularly around the knowledge and awareness piece at the moment. So, kids or adults might not be able to go and learn to swim, but you can still be learning through, education and awareness. And just going back to what you were saying before around swimming being one of the best activities, for health and well-being. In terms of where Australia sits with chronic diseases, Stacey, how, in your eyes, could we nudge the system to try and improve the health and well-being of Australians? And it might not necessarily have to be just with swimming, but yeah, what's your thoughts on that?
I think one of the things I've seen that's been really, I guess, one of the positive things out of lockdown is seeing so many people get out and about. So seeing people running, walking, family groups, kicking a ball around, going out on bike rides. So I think that's one of, but there's been lots of negatives, obviously, about COVID and lockdown. But on the flip side, I've seen a lot of people out and about and sort of getting in their exercise because they haven't been able to otherwise. So I think that's really important. But also, I guess, going back to the swimming and the benefits of swimming, being a low weight bearing activity, so good for cardiovascular and health. And certainly with the research that I've been doing, the mental, social health and wellbeing aspect of swimming is really, really important. And that's actually why a lot of people are choosing to do swimming over other activities that I've spoken to so far. So that's been really positive as well. And I think it's about focusing on the fun and the social aspect as well. What are the benefits that people are going to get? One of the health promotion programs that I talk about being involved in Auckland, and I always talk about this one because I think it was really clever at the time. So it is a women's swimming program. However, it was set up as a health promotion program with a range of different partners from within the health sector. And so whilst it was in a facility that had a gym and also had a swimming pool, and one of the conditions for the women attending is that they had to do at least half an hour of physical activity before they could get in the spa and chat and have their social time. So the gym would be open. There would be different Pilates or yoga classes going on. There was the swimming pool, and people could swim laps or do water aerobics or do swimming lessons and that sort of thing. And it was, as soon as that half an hour was up, then some of the women were in the spa and that was their chatting time. So I think also taking that broader health and wellbeing approach is really important as well. And thinking, I don't have to do it, but I want to do it. And whether or not that be a walk with a friend, that's really important. And especially at the moment with the COVID restrictions here in Sydney and around the country, getting out, getting some fresh air, and having a chat, and getting that exercise and incidental exercise as well.
Yeah, I agree with all that, and I love that. Making sure they do a little bit of exercise, and then they can go and have a chin wag and a bit of a chat with the mates. Very cool. This leads us to the last question, Stacey. So you're obviously, you working as the national manager at Royal Life in research and policy, and you've got a PhD and all this work that you're doing. But where do you see yourself personally within the system, and how do you contribute and influence it?
That's a really interesting question. And I've been pondering this one. I think for me, it is an interesting one. I think for me, it's about connecting with community and actually understanding what the community wants. I think that's really important. Everyone is doing an amazing job. And I say this in terms of relation to swimming and water safety and providing drowning prevention strategies for high-risk populations. But from my experience, being both a practitioner, so developing and designing programs with communities and also evaluating those programs, I'm really drawing on my experience with communities and having the experience with those programs and the value that communities bring in terms of making a program successful. And so I hope with my research, by, I guess, talking to people from different backgrounds, those who have moved to Australia and those who have been in swimming programs, as well as program providers, that I'm able to, I guess, bring a greater understanding of what people need, what people want. And I guess the skills around swimming and water safety won't necessarily change. We want people to float and, learn how to do swimming and water safety skills, and that's all linked to our National Swimming and Water Safety Framework. But how it's delivered and how things can be tailored to certain communities is really important. And I think that's probably where hopefully my research will be able to provide an insight from a participant point of view. And I have been I've tried to be very cognizant of involving participants and communities and community leaders as well, because they're really key for getting people involved as well, and getting them on board and encouraging people to get involved, and particularly swimming and water safety, but it could be any other activity as well. So I think that's sort of where I fit in, is sort of doing the research, but making sure that I involve the community. And then I guess any recommendations are all, I guess, coming from a participant perspective. And then hopefully that will then influence how programs and policy are developed in the future for high-risk populations.
Yeah, wow. And I think it's very admirable what you're doing, right? Because if I simplify it, your work's going to be saving lives, right? Whether it's writing policy or programs or designing them. But the language you use is really interesting, Stacey, because you say working with community. And I think that's really, really important. It's not in community, it's with. So you're designing these with the communities and having them involved, I think is super important. So well done in everything that you're doing. And I'd just like to thank you, Stacey, for giving us your time today. It sounds like you're very busy and you're doing all these chats around the world, with it being, the National Drowning, the National Drowning Day. So really, really great to speak to you. And is there anything else that you'd like to add?
Gosh, I think we've covered almost everything.
We've covered some ground, haven't we?
We have, and I thank you so much for your opportunity. It's been really interesting, and thank you for your interest as well. And I guess I just wanted to say there are some amazing programs and I guess not just programs, but strategies, and there's a lot of work being done in this space. And I would like to acknowledge everyone that's, that is doing something, not just for multicultural communities, but in terms of drowning prevention across Australia and across the world as well. Because there is some great momentum going on, and particularly that with having released the new Australian Water Safety Strategy earlier this year, there is room for a lot of different organizations, bodies, but also individuals to get involved as well. As I said earlier, it's about partnership and having people from all sectors involved. And it doesn't have to be high level. It can, we can make change at an individual level as well. So thank you to everyone for doing your fantastic work, and also David as well for taking an interest and having me speak to you today. Thank you.
Oh, it's been my pleasure, Stacey. We'll probably have you on in a few years when you've finished it and you can tell us, all your findings. That would be wonderful.
Oh, thank you.
Okay, all right. Well, you take care of yourself, and I'll hopefully catch up with you soon in person when this lockdown ends.
Thanks, David. You too.
All right. See you, Stacey. Bye.